around being prepared to lead a nonprofit volunteer-based organization. So part of the Leadership Institute's mission is to provide the intentional development of leaders who are skilled in some of the key aspects of nonprofit leadership, nonprofit governance, fundraising, programmatic development, the use of technology, and also the communication skills that's needed to properly position and talk about the mission of the 100 to our stakeholders, to our community, to potential funders, and the like. And so the curriculum of the Leadership Institute was built based on the needs of those types of leadership development skills, competencies that I just mentioned. So with that, we're going to transition now into a discussion with our panelists around why it is important for them, as well as us, to participate in the Leadership Development Institute and how that will manifest for the benefit not only of the 100 Black men of America, but also for the benefit of our 104 chapters around the United States, in Europe, and in the Caribbean.
What's most important is that with the gentlemen that have joined us today, they are actually involved in emerging leaders chapters. And so we want to be able to talk about this Leadership Institute and the importance of how they think that this will influence them. So we have provided them with some questions. But before we actually go into the questions, gentlemen, just tell us a little bit more about yourself and the Emerging Leaders chapter that you host. And just tell us about your membership and the existence of your chapter. We can start with Kyle. Thank you.
Certainly. So thank you, Thomas, and thank you, Chairman Milner. And we're just honored to be here today to talk more about the emerging chapters and the work that we do. With the Emerging 100 of Atlanta, we've been in existence since 2010, so roughly about 10, 11 years now. And with our membership is comprised of roughly about 120 members, consisting of individuals who are in healthcare, the financial industry, accounting, attorneys, people who work in nonprofit and education, the clergy, marketing mavens. I mean, everyone, every industry and every profession you can name it, our membership is composed of it. In regards to the emerging, we really focus on making sure that we're enhancing the mentoring and tutoring programs of our parent organization, the 100 Black Men of Atlanta, and of course, the 100 Black Men of America. And so we work closely with the students at Best Academy High School here in Atlanta, and also students with the Collegiate 100 of Atlanta throughout various campuses throughout the city of Atlanta. Last but not least, we focus on providing scholarships to students to help them with their journey, going into college, going into the career and the workforce. We pride ourselves on being able to equip people in the community with the resources that they need to be self-sufficient and to become the best citizens that they're looking to be. And so myself, being a member of the Emerging since 2016, been able to see a whole lot of great things regarding the work that the 100 does, and us as an emerging chapter alongside those with Jared, just trying to make sure that we do the right things and that we're good stewards of our work and that we leave an impact on those that we serve here in the community. So that's just a little bit about ourselves.
Thanks, Kyle. And Jared, if you can give us an opportunity to hear about you, and even for those that are watching this, some people don't even know what it means by what is an emerging leader chapter. So in your introduction, can you explain that a little bit more as well?
Yes. Well, again, thank you all for having me. It is my esteemed pleasure. As I mentioned earlier, I do serve as the president of the Emerging 100 South Metro Atlanta, that's headquartered out of East Point, Georgia. To give you an understanding of what the importance of emerging leader chapters and the Emerging 100 chapter is, that we are the subsidiary organization of our parent of our parent chapter, the 100 Black Men of South Metro Atlanta. We comprise of individuals from the ages of 24 to 35. As Kyle mentioned, we also have people in multiple areas. Our members comprise of members in technology. We have directors of higher education, we have procurement professionals, we have multiple different levels of professionals in our organization, in our chapter. A little about myself. I've been in the chapter since 2017. I'm sorry, since 2018. The chapter came into existence around 2016, 2017. So we are somewhat of a younger chapter, but it does not reflect in the service that we do in our community. We have a very strong relationship with the city of East Point, where we are headquartered out of. We do a lot of community service with them. Also, we support our Rites of Passage program, which is our mentoring program for our chapter, where we have high school students who we teach different professional skills and teach them a lot of life skills throughout their program. And that's just a little snippet about what we do at the Emerging 100 South Metro Atlanta.
Well, thank you very much. And in fact, I'm actually going to punt this over to my co-chair, because we really want this to be a dialogue. As we kind of like talked about in the presentation, this Leadership Institute is designed to make sure that we can move chapters ahead in terms of building and developing leaders for the future. So we really want to be able to talk with you all today, because since the Leadership Institute will now be available to emerging chapters, we want to get some perspective from you about how you feel about that. So Keith, I'm going to kick that back over to you. So let's kind of like get these guys involved in some good discussion and really pick their brains to find out why they think that this could be good for the 100 as well.
Well, thank you, Thomas. And again, gentlemen, this initial cohort for the Leadership Institute is focused internally, meaning that any member who is financial has the opportunity to apply and be considered for selection. And as you all know, there are not emerging chapters consistently established throughout the family of 100 chapters. However, our structure overall does start at the high school and preschool, middle school mentoring, and then collegiate, and then emerging, and then ultimately transitioning into the legacy, as we like to call it, the legacy membership. Mm-hmm. And so again, one of the main points of developing a Leadership Institute is to continue to create a pipeline of well-qualified individuals who have the skills and the necessary training to transition into leadership positions of a nonprofit in their local communities. Mm-hmm. So with that, Kyle, I'm going to start with you. Talk about the challenges and the opportunities that you have experienced as part of an emerging leader, and particularly around, I'm going to say, fundraising.
Mm-hmm. Awesome. And thank you for that, Keith. In regards to some challenges and opportunities, as an emerging leader and as a member, of the Emerging 100 here, I have been able to ascertain and interact with members of the 100 Black Men of Atlanta and those from the 100 Black Men of America, just due to the network. And so in regards to opportunities, I myself work in fundraising. I work with the Boys and Girls Clubs of Metro Atlanta here in Atlanta. And so I've been able to see throughout the nonprofit and corporate sector here in Atlanta, all the opportunities that I could have to bring together like-minded partners, whether they're corporations, whether they're nonprofit organizations, whether they're individuals and entrepreneurs, to bring together those resources that can then help the students that we serve through Best Academy, through the collegiate, provide them with the opportunities to be successful in college, in the career workforce. And so opportunity-wise, the sheer connection as being a member of the emerging has allowed me to dibble and mingle around with individuals who I may not be exposed to on a normal basis. And so first, the exposure and the access is crucial, opportunity-wise. Regarding challenges, one thing that I'm really, interested in and excited about with the Leadership Institute is that a process is being normalized and created for individuals from various chapters, literally as we're trying to, spark and create more chapters throughout the nation, to know how they can also receive that same access and opportunity. Like you said, Keith, there are chapters that we're trying to create and that we're trying to grow. And of course, with myself, Jared, anyone who's, members of an emerging chapter, we want all of our members to receive the same opportunity to be equipped with the tools that they need to lead nonprofit organizations or lead organizations that they work for and give back to the community. So I think it's a great effort by the 100 Black Men of America to normalize a process that can be conducive for all members of all of our chapters.
Thank you, Kyle. And so, Jared, I'm going to transition to you as a relatively new chapter of the Emerging. Speak to the group, if you will, about governance. You very accurately and eloquently described your Emerging chapter as a subsidiary of the parent chapter. So from a governance standpoint, would you share some of the discussions and some of the continued operational discussions you have with your chapter president, your chapter attorney, and so on and so forth, in terms of how you guys operate, what's in bounds, what's out of bounds, so on and so forth?
Yes, I'm glad to. So as the president of the Emerging 100, my main focus is to make sure that I maintain a good relationship with our parent chapters administration. So also my president of the chapter is President Rafiq Ahmad. President Ahmad and myself, we speak almost daily, if not weekly. And the importance of that is to make sure that we are always in tune, whether it's with the members of the Emerging 100 or the members of the 100 Black Men of South Metro Atlanta. That is very important. The governance aspect and the relationship aspect is extremely pertinent. Another thing as well is we have to make sure, regardless of what enthusiasm we have, regardless of what ideas we have, we always have to make sure that it is approved by the general body first before we make moves on anything. If we miss the link in that chain of command, that will always cause issues. So we make sure that we have that relationship established. Before I was the president, I was the vice president of the Emerging 100 South Metro Atlanta. So therefore, building that relationship has not been overnight. This has been a process, because when I came in as a vice president, we were in the process of transitioning to the administration of President Rafiq Ahmad. So the governance aspect and all of, whether it's fundraising or whether it's simply community service, all that aspect needs to be nurtured and it needs to be fostered, as far as making sure that your chapter, whether it's the Emerging 100 or the general body, make sure that they are linked together so that we can accomplish the joint goal.
Terrific.
And Keith, what I've enjoyed hearing about these two gentlemen already express is their connections to their parent chapters. I think that speaks very, very well about what it is that you guys are trying to do in your respective chapters to stay connected. And because of the fact that this is about a leadership institute, can you share what you're doing in your own respective chapters to recruit and or develop your own leaders within your chapters?
Definitely. So I'll pick on that, and actually I'll piggyback off of Jared a little bit. We both share the same journey of serving as vice president before serving as president, and I think that speaks to, in connection with the Leadership Institute that the 100 Black Men of America is putting forth, succession planning. Building up members within your organization. For us, with the Emerging 100 of Atlanta, we have an executive board comprised of 5 individuals: president, vice president, treasurer, secretary, and parliamentarian. And underneath that, we also have committee chairs, people who are over the work that we do at Best Academy, Collegiate 100, community service, something we call emerging development, which is inward focusing in regards to the camaraderie with our membership development. And we really empower and provide the tools and resources to those chairs to take onus and ownership of the work and the programs and initiatives that our chapter produces. And so with that, I think that's a conscious effort and an intentional approach that our members respect and appreciate, because then they're given an opportunity to show their leadership, gain opportunity to provide ideas and programs that we may not have done before. And then from there, you kind of pique their interest a little bit more to potentially serve on the board and end up being the future leaders of the chapter moving forward. So that's something, intentionally that we strive to do. It's been working very well as currently, and we hope that it continues to work well as well. So we can have great leaders succeed us in the future.
Correct.
Jared, would you like to comment on that question?
Yes. Also, we share very similar processes with our chapter as well, where I like to say that we empower our committee chairs and we empower our board members to let them know that we have the general body, our parent chapter, to back us 100% no matter what we do. You also asked, what are we doing to help foster those mentorships, I'm going to call them, within the chapter. So what we do personally in South Metro is when a new member comes into the chapter, we automatically assign them two people. We assign them a seasoned member in the Emerging 100 chapter, and then also our general body is assigning a mentor to our members as well. So it's not just the only people getting mentors would be the kids. Of course, we would like for them to have mentors as well. But again, we can't be better mentors and we can't be better members of this organization if we don't have guidance ourselves. So we make sure that we attach a mentor to a new member from the Emerging 100 and also a member from the general body. So those are two things that we do to help foster those relationships. As far as recruitment is concerned, we recruit during community service. A lot of our membership has came from people who observed us doing community service, and then we'll have our informationals and we'll have pretty decent turnout. So those are some of the things that we do at the South Metro Atlanta chapter.
Terrific. And I'd like to ask both of you, and we're going to stay with Jared and then kick it over to Kyle to answer this question. As you think about the progression, I mean, each of you are fortunate to be part of an emerging that also has a legacy chapter. What are your expectations individually? And if you could just share what you've heard some of your other emerging members articulate as their expectations about continuing to evolve and progress and ultimately become members of your respective legacy chapters. So what are your future expectations? What do you see as needs that the Leadership Institute can help fulfill? And where do you anticipate being able to go with the Leadership Institute behind you?
Mm-hmm. Well, thank you. The Leadership Institute is going to be a very, very, very special addition to this organization. And it's simply because we have plenty of members who just need that extra push in order to pull out the leadership that's inside of them. One of the main things that our chapter is doing right now, by us being a newer chapter, is we are now at the phase where we are growing. And as we are growing, we are now creating these different partnerships with all these different organizations. And that alone is going to help us achieve the goals further on in life. Right now, we have a decent amount of connections and a decent amount in our network. But right now, again, we're reaching out to multiple organizations in order to continue to make that grow. We obviously have observed the Emerging 100 chapter in Metro Atlanta and watched as they operate and somewhat pick their brains, I should say, in order to help formulate what we want and what we're looking for in the chapter. So those are some of the things that we're doing.
Thank you, Jared. Kyle?
Yeah. So in response to your question, I think in regards to expectations and just standards, as Jared mentioned, we have membership, informationals, and we have events where we want people from the community, people who meet the criteria of that, 25 to 35 young African-American males really striving to, succeed and be servant leaders. We want them to know that when you are striving to become a member of the emerging, that you should be ready to lead. You have, these talks about the 25% and the other 25%, and who's really going to do the work and who's going to be about it per se. And for us as emerging chapters, we know that the work that we do is an extension and a reflection of the 100 Black men, of Atlanta, of South Metro, or of America. And so with it, in regards to the standards and expectations, my hope would be that the Leadership Institute backing us and being a resource for members of our chapters would help empower and help equip our members with the tools, the tangible tools that they need in order to really govern and operate our organization in a way where we put out all the results that we want to see. We're able to provide the scholarships to students on a yearly basis. We're able to help more students get into college as they see fit or going to the workforce. We're able to provide career development, workshops and opportunities for young professionals in the community. And so with the Leadership Institute backing us as emerging leaders and emerging chapters, I see a runway for members to gain the competency and the next level of professional skills that they need in order to truly be a leader of a nonprofit organization and be a good steward and servant leader in the community. So those are my expectations and my standards, and I want that to be reflected throughout our chapter and across all of our members.
Thank you.
Well, Keith, I think these young men have explained this so well. And I just love hearing the energy that they have associated with knowing that they have an expectation of leadership coming into their organizations. So I'm not going to play devil's advocate here, but I think that because you both have explained about the parent company, which we would call the 100 Black Men of America, and of course, the satellites being the emerging chapters. If you had the ear of our chairman and vice chairman or other board members about succession planning, what is it that one particular aspect that you would like for them to know from the emerging leaders about future succession planning for the national organization as well?
Jared, you want to take that first, or would you like for me to go, brother?
Yes. Yes, and to kind of
this is your chance.
Yes, and to further the aspect that Kyle just mentioned about the expectation of leadership in our specific and informational this year. I told them, I said, we are a growing chapter and we are not looking for members. We are looking for leaders. We are looking for fellow leaders to help us accomplish our goal. If that is not your goal, then maybe this is not your call. And not to be so direct, but the reason being is because as we all known and seen over the years, this is a prestigious organization filled with leaders, and we want to continue to grow as that and not without losing sight of what we are trying to accomplish. And I say all that to say is that links into the succession planning, because one of the main things that we need, as I mentioned earlier, is that mentorship from the actual administration. So of course, we probably can't get it from the actual headquarters here in Atlanta, but as far as chapter is concerned, I feel like there needs to be some type of connection where if you're the president of the general body chapter, you need to be mentoring the president of the Emerging 100 and so forth and so on. Board members, whether you're a committee head, the committee head of the general body should be mentoring the committee head of the Emerging 100. And the main purpose in that is that when it comes our time to serve in the general body, because of course that time always comes, and when our time comes, we don't want to miss a gap. We want to hit on all pistons to make sure that we are able to keep running and not be stifled in any way. So that is the main thing that I'm echoing, that if we can establish some type of pipeline where if you become, if you qualify and you become a board member of either the Emerging 100 or the general body, that automatic connection should be made. There should be no reason why there's a treasurer in the general body not knowing what the treasurer in the Emerging 100 is doing, et cetera, et cetera. So that's one of the main things that we speak about all the time, just simply saying, and of course, a lot of us are already leaders. some of us served in previous organizations and so forth, but the main thing we want to do is make sure that there's housekeeping inside of the 100 Black Men of America in our specific chapters to continue our progress.
Outstanding. Wow. I mean, that's if they could only hear, the fly on the wall. Boy, you said a lot. Jared, Kyle, what would you add into that? Because I think that Jared has given us a lot for our parent organization to hear what you just got through saying. So what would you add into that conversation?
Yeah, definitely, Thomas. So I think Jared really hit, the nail on the head there. And I think what he was really speaking to as well is investment. When you think about, the 100 Black Men of America and just the umbrella there, and then, all the chapters of the 100, and of course, the emerging that fall underneath that. The reason the Leadership Institute is coming about is to create, more of a tangible pipeline and session plan and just a roadway for our members, to travel. The emerging, in itself was created because there was a gap from, your high school and collegiate students tied to the 100 and programs, project success and things of that nature, to then becoming members of the 100 Black Men. And so in between, there was, a loss, and the solution was create emerging chapters, for individuals who are 25, 35, looking to be groomed, looking to provide with those tools to one day be a member of the 100. The members in the emerging chapters, of course, want to one day be members of the 100 and carry on the legacy and the work of those who are currently members. And so my charge would be that when the 100 Black Men of America and also the bigger chapters as well throughout the cities are having certain events and conferences and things of that nature where a lot of 100 leadership is involved. I would want the ear of the 100 leadership to always be thinking about the members and the leaders of the emerging chapters and seeing how they can be invited to the table. How can they mix and mingle? What things can they do, and learn from by being, in the room or attending the event or joining in the conference or maybe speaking, at the conference or at the event. I think, continued investment by actively having emerging members and not just leaders, but also maybe committee chairs and, of that nature as well, involved in the nitty gritty of the 100's operations will build more synergy and have that return on investment be even, bigger than, imagined. And so investment is my key word there, and intentionality with having emerging leaders actively participating in events at a grander scale.
Awesome. So we've been speaking a lot about the internal focused objectives of the Leadership Institute, and you guys have done a wonderful job of articulating, what those opportunities are. But the Leadership Institute Committee also anticipated from an aspirational standpoint that there would be benefit externally to the 100 for those graduates of the Leadership Institute, that they would be better positioned and competitive to serve on for-profit boards and not-for-profit boards at the local, regional, and national level. But some people asked us, why does the 100 need a Leadership Institute? Because there's many organizations out there already, private colleges and universities, consulting firms or whatever. And so I want to speak to that, and I want to ask you guys to also comment. We as Black men have a lived experience, and leadership the 100 way, through the values of being a Black man in America, someone who is committed to the mission of the 100, puts us in a unique position to think about and execute on leadership. And so with that as a backdrop, and the fact that we have at least 3 generations within many of our chapters, and generational differences being what they are, would you guys speak about what it means to be a Black man and to be a Black man trained to be a leader through the lens of social justice and through the lens of your lived experience as a Gen Xer or Gen Yer? Jared, I'm going to start with you.
Well, thank you very much. By myself having experience in other leadership institutes, having an institute with the 100 Black Men of America is going to be such a home run. And the main reason is because the 100 Black Men of America the institute is going to reinvest in all of these Black men in this organization who are coming from all the different fields in their careers. And what they're going to do is that we are going to create a nucleus of power, essentially. So having this organization fulfill the needs of this institute, I just personally feel that it's going to carry on throughout generations. The importance is we are hearing people that look just like us, that talk just like us, that went to college like us or may not, who are in careers just like us. We don't have to go outside of our organization to find fellow members like that and to help us along our journeys. They are going to be in-house, and the benefit of it is the exposure that we're going to get. This is going to easily catapult this organization to the next level. That's just how I truly feel about the Institute. When I first heard about it, I knew automatically that this is going to be it. This is going to be the one. And I think that everybody's going to be surprised with the results and with the leaders that this institute is going to create.
Thank you, Jared. Kyle?
Yes, definitely, Keith. So when you speak from the lens of being a Black man and a leader in this organization, whether it be, Emerging 100 chapter or the 100 Black Men of America, there is no better time than now for an institute of this magnitude to, be rolled out and to be normalized as a process within the 100 Black Men umbrella. During these times, as we're, combating a pandemic, as we are trying to get out of that, as we're also consistently, fighting, the battle through, racial injustice and racial equity, I see that this institute will help our members become more well-rounded and multifaceted in their ability to be advocates and be leaders within the community. And so whether we have members who are striving to, be presidents, CEOs, or, C-suite executives for Fortune 500 companies, or if they're trying to launch their own nonprofit or trying to be a leader in healthcare, whatever you name it, you also have individuals who are trying to speak on behalf of those who are often, unheard and not seen. Good morning. Sorry about that. I'm at a school. Give me 1 second here.
Hey, that's a part of life that we go through as we're all probably still working through our working day. So don't feel too bad about that, Kyle. But go ahead, continue if you can.
Yes, and thank you for that pause. Hey, technology, y'all know how it goes, and working in the school. But as I was saying, Keith, I think that it's very important for our members to be given the resources and the opportunities to become more well-rounded as servant leaders and civic leaders. And so whether, through the Institute, we're able to not only able to know how to, lead a nonprofit or, work in the corporate sense or create our own entity, but if we're able to be the ones who are amplifying the voices of those who are misrepresented or misheard, that's the duty that we have as Black men to provide to our community. And what better way to be able to be equipped with those resources than through the Leadership Institute? We have, in the emerging chapters, and I'm sure Jerry can speak to it as well, like we have members who are members of, fraternities and groups and affinity groups where they've been taught about leadership. But as we continue on in a professional sense, the 100 has, predominantly always been a well-known entity within the community that's well-respected and dignified. And so us as, the next generation and trying to lead that, we need to be comfortable in being uncomfortable and speaking up, when the time is right, bringing together the resources and the organizations that need to be had, no matter what the race, color, or creed is of anyone that we're working with. We have to be the ones who are ready to carry on the flame, the torch of the 100. And the best way to do that is through this Leadership Institute that can be provided to our members.
Awesome.
Well, gentlemen, we've talked about a lot about the different whys about why we're doing this Leadership Institute. Keith, I think that we probably need to talk a little bit about the what, because the fact that, not sure if you know some of the dynamics, and for those who will be watching this presentation, that the Leadership Institute is scheduled to start in January of 2022. And because of the COVID world that we're still living in right now, it is still going to be a virtual presentation. But that virtual presentation will consist over a 7-month period. And dynamically, though, with this first cohort that we're looking at 14 members who will be a part of this initial cohort that will go through the very first program for this institute. And that's a reason why because we have 104 chapters across the country, and then we have our emerging leader chapters, we're looking for your input in terms of members from your chapters that might be interested in that process as well. So really convince us that if we were the interviewing committee right now, convince us as to why we should take someone from an emerging leader chapter. Jared, we'll start with you.
All right. That is no problem. I can definitely take this away. My personal opinion, you will benefit everything that you invest in an emerging leader, whether it's somebody from the administration of the Emerging 100 chapter, or whether it's a regular member or a committee head or somewhat so forth. You have the opportunity to build from within and to keep the talent that this organization has within. As Kyle mentioned, we have people from different walks. We have people from different organizations, whether it's Greek or whether it's other nonprofits, for-profits. And the beauty of the 100 Black Men is that you bring all those different organizations together. And when you bring them together, it's like an all-star team. That's the way I like to look at it. So what you would benefit from somebody from our chapter specifically is that our chapter, we have similarities. We all hardworking. We all are service oriented, and we all are coachable. We're teachable. We're all of the above. We are able to provide that skill that helps you listen to become a leader, that humbleness that you need to listen and to also lead. So those are some of the things that you would benefit from getting somebody from the Emerging 100, whether it's in the South Metro or Metro Atlanta. That is one of the main things.
Well, it sounds like we're kind of like having these two guys vie for position. So I think that he's done a pretty good job here, Kyle, of making his point here. So I want to be able to hear how you can counter that, because if we're choosing between the two of you guys, why should we consider someone from Kyle's group?
Mm-hmm. And first off, it's all brotherly love. So, we want everyone, as we might say, we want everyone to eat. We want everyone to prosper and thrive. So Thomas, I'd hear you on that. But Jared said that very eloquently and very well. On our behalf, on behalf of the Emerging 100 of Atlanta, I think about the fact of, trying to nominate or promote or suggest any members from our chapter to participate in the Leadership Institute. I first think of the fact that when we go back to informationals and when we're trying to recruit or, welcome potential members into the organization, once again, the standard and expectation is that people are coming into this organization with a fervor and a hunger to lead. And so naturally, with 100 Black Men of America, you want individuals and Black men who are ready to lead, to advocate, to have the tough conversations, to, stick up and do what's needed to be done. To do some of the things that are mundane or monotonous at times, and then also to do the things that are large scale in front, in a conference room or, at a big event. And so with our membership, like I said before, we're comprised of individuals from all different industries. But Jared could say this as well, is that we just have people who are ambitious, hungry, and driven and ready to take up the mantle and just really run with it. And so with our membership, I would encourage and say that there are plenty of members, not only from leadership, but also those who we classify as general members. But I don't even like that term, because every member within our organization has something to contribute to the organization. And there's a lot of unique talents that our members have that the Leadership Institute can benefit from, that the 100 Black Men of America could benefit from. And then you're ending up, once again, investing and providing a track, and a pathway for individuals from our chapter to then provide, the benefits and the resources and overall the opportunities that the 100 needs in order to thrive and continue to be a sustainable and impactful organization within the community. And so that's my pitch. I'm saying we have the best of the best. The emerging chapters have the best of the best, and why not look internally to make sure that you're picking the right people to lead and take this organization as the 100 Black Men of America to the next level to serve our community.
Well, Brother
Outstanding.
Thomas, I think that might be a drop the mic moment. I don't know if we could actually find a better answer to conclude this conversation around. So with that, gentlemen, thank you so very much for your time and for your input. This has been quite exhilarating for me personally to be in a position to help bring this institute to life. I'm just looking forward to having the cohorts go through and continue to grow and develop. The 100 Black Men of America has a focus on four for the future: mentoring, education, economic empowerment, and health and wellness. And underneath that, as Brother Thomas talked about at the beginning of this session, we have to have qualified, empowered, enabled leaders to be able to continue to sustain and grow this organization and take it to levels that it has never seen before. The need for our organization has never been greater. The mission is still as relevant today as it was 36 years ago when our founders concepted this organization. And we need to be in a position to support and enhance the members to be able to continue to take it to the next level. So with that, gentlemen, we're going to conclude this conversation. Thank you very much for your time. The nomination process is open. The application process is open. So please, please, please get your applications in. And we look forward to talking with you again. We're going to have a series of virtual town halls over the next couple of weeks to be able to answer your questions or address any of the concerns that you might have as it relates to the process of the Leadership Institute. And so with that, Brother Thomas, do you have any other concluding comments?
Well, what I'd like to be able to do is to have our two panelists give any closing remarks that they'd like to have as a result of being a part of this. We want to thank them, and then I'll just close us out with some final comments. So, Kyle, if we could start with you with your closing comments.
Yeah, first and foremost, just thank you for the opportunity to participate and speak today. As I've stated, being a member of the Emergence since 2016, been able to really see the intentionality and the care that the 100 Black Men, of Atlanta. And once again, definitely shout out, of course, to Chairman Milner for just his intention as well to help me grow as an individual and help me grow as a professional and a leader. That's a true testament to the pathway and the pipeline that the 100 is trying to, create. And of course, to Thomas and the rest of this team, and of course, the 100 Black Men of America leadership, Chairman George. I mean, it's I can't even find the words really to just thank you all for the participation, because this is an opportunity to be in the room and be in an understanding of knowing what's to come. And I want to make sure that I, as a servant leader and as a good steward, and making sure that I'm providing members of my chapter with the resources to also get a leg up and to know how they can succeed. And so to all those who are watching this and tuning in and learning more about the Leadership Institute, I definitely just want to encourage you to take the opportunity because you have no idea how it can help shape your future. And of course, help you be a servant leader within the community to all those that we serve. So thank you to all for allowing me to be a part. And I look forward to supporting and being a contributor to future endeavors too.
Thank you, Kyle. And thanks for being a valued member. Jared?
Yes. Again, as always, echoing Kyle, I would like to thank everybody for the opportunity to speak today. I would like to thank our chapter alone, just being supportive of me and my administration. One of the things that I do want to say is that being a part of the organization as a whole is I'm going to say an upgrade, is an upgrade, and also is a privilege. And I think everybody should be aware of that opportunity that they're given when they wear the 100 Black Men pin or the Emerging 100 pin. Also, that as far as the Institute, I just personally think that we as an organization is going to help us continue to groom all the leaders to the in order to move to the next level. Having the Institute back us is going to provide the resources. It's going to provide the professional development. It's going to provide those missing links that you may not have gotten when you were in college or when you were taking a course or whatever, so forth and so forth. And it's going to allow us to be put in these different conversations that we wouldn't be a part of just off the fact that we're younger. So now when we come to these conversations and we're meeting with organizations and we're meeting with different companies, now instead of looking at us as an, they're young, because you have a lot of older people in leadership positions. But when they see us younger people now come up, now they're going to be forced to look at us in a different light because of what the Institute has given us in the tools that it's going to provide us in order to succeed.
Well, Jared, I want to say thank you very, very much for that. And thank you, panelists, for being a part of this. And thank you for carving out a part of your day to be a part of this conversation. Again, as our co-chairman had said in the very beginning of this program, we want to thank our executive sponsor, who is our vice chairman of the board of directors, for his support in helping this to come to life. This Institute has been tried several different years ago, but we want to make sure that this is going to be something that's sustainable for the future. Then most importantly, we'd like to thank our sponsors, our financial sponsors that have contributed their dollars, who have an investment in us. We were on the phone with them, a couple of them the other day, and they really believe in what we do in the mission of the 100. So we are honored to be a part of what they consider to be a financial contribution to support what it is that we do. So on behalf of myself, on behalf of our co-chairman, and on behalf of the leadership committee in general, we would like to thank each one of you all for joining us on today. And we hope that you will take all of this information that you've heard on today, allow it to give you a reason to understand that we're not trying to create something for political reasons. We're trying to create something that will make this organization, which has changed countless lives, to be a viable organization, to have and create a pipeline of leaders who will change this nation, who will change this world. So thank you for joining us. We'll sign off to each one of you all right now. And thank you once again. Have a wonderful weekend.
At Geico, our strategy includes community engagement. Part of our vision is improving our communities and supporting local organizations through volunteer and outreach efforts. We want to help build stronger communities for tomorrow by investing our time and energy today in financial literacy, food insecurity, the environment, and other community-based initiatives. We call it our insurance plan for the future, and it's a policy we're proud of. We're honored to be a partner and look forward to a positive future together.
Hey-ho, let's go. I'm Dr. Mark Allenderry, and I'm an infectious diseases doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. Speaking of special, today's podcast is coming live from inside the human body.
So, Doc Griggs, does that make it a podcast?
Dude, don't make me regret sharing my space-time hop trick with you. Thanks, TV sitcoms.
So, these COVID-19 vaccines are super safe and effective, and thankfully, were developed quickly in response to the global pandemic.
First, let's explain how the coronavirus makes us sick. Ooh, check out those spike proteins on the coronavirus. They help it burst through healthy cells, where it replicates inside, destroying the cells and making us sick. I really hate that dude.
The vaccine will take care of him. Vaccines stimulate your immune system to fight viruses. Some of the COVID-19 vaccines work by delivering mRNA to your cells. Think of mRNA as instructions that activate the immune system.
Let's check out a healthy cell to see how mRNA works. The COVID-19 vaccines deliver a package loaded with millions of mRNA to your cells. Then the ribosomes read the genetic code on the mRNA like a manual and produce spike proteins that mimic the COVID-19 ones. That stimulates your immune system to make antibodies. Now, off to the lymph nodes.
Here's where antibodies are created. The heroes that fight coronavirus. The spike proteins attach to the antibody, leaving an imprint of the spikes, basically setting a trap for the nasty coronavirus.
When this part of the antibody attaches to these spike proteins on the coronavirus, it immobilizes the virus and stops it from infecting our cells and making us sick.
If an actual coronavirus comes into the body, the antibodies are ready to rumble.
Battle faster!
That's why COVID-19 vaccines are essential for teaching your immune system how to fight off the coronavirus.
And that's our show for the day. Ready to roll?
I've got this. Hey-ho, let's go. I'm Dr. Mark Allanderi, and I'm an infectious diseases doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. On this episode of COVID Noise Filter, we're talking about COVID vaccines and variants.
So you meant to snap us into some three little pigs' tale?
Watch and learn. Imagine your body is like a house, and COVID-19 is trying to break in. Antibodies created from vaccines are like your security system, recognizing the intruder and destroying it. But viruses are smart, and they mutate, putting on new disguises to bypass your security system.
Even if you're vaccinated, COVID-19 variants will emerge and transmit, and your antibodies will have trouble recognizing them.
That's why we need a booster shot.
mRNA vaccines help your immune system recognize COVID-19. When the virus mutates, the booster shot provides updated antibodies specifically designed to fight these new variants.
Basically, we need to update our security system to keep out these new nasty neighbors.
That's a wrap on today's episode. Ready to roll?
Dude, please, no, please don't.
Good afternoon and good evening. I'm Mark Alexander, Secretary of 100 Black Men of America, and I'm the chair of the 100's Health and Wellness Committee. Welcome to our workshop entitled Vaccines, Variants, Kids, and Boosters, Addressing the Winter of Our Discontent. As we approach year 3 of the COVID-19 pandemic, 100 Black Men of America remains vigilant. While we are in much better position to fight against COVID than we were 2 years ago, we are by no means out of the woods yet. This insidious virus will not be defeated without patient, concerted global efforts. We've assembled an outstanding panel of experts that will provide information on where we are in the pandemic, and they will make recommendations for halting the virus spread throughout our communities. We'd like to thank our partners at the Morehouse School of Medicine's National COVID-19 Resiliency Network. 100 Black Men of America is working shoulder to shoulder with NCRN in protecting vulnerable communities from COVID. Dr. Eric Griggs is the moderator for today's workshop, and he will introduce our panelists. Dr. Griggs is the Director of Community Medicine for Access Health Louisiana, and he is the 100's COVID-19 Action Group leader. Welcome, Dr. Griggs.
Thank you, Dr. Alexander. Now is the winter of our discontent. That's a phrase that was uttered in a speech given by King Richard in regards to his discontent and his family's reversal of fortune in Richard III. It couldn't be any more appropriate than now. This is the winter of our very much discontent. Last year, we were all dealing with the underlying angst of will the vaccines work? We were in December. Are there going to be vaccines? When can I get my vaccine? And believe it or not, here we are going on year 2, a year later, and now we're doing picks and chooses. We're doing a yeoman's work of convincing people to get the vaccines. We've endured the wave of the Delta variant that is not over across the country. And the moment we get to the winter, we get our vaccines for kids, our teens, all ages. A new player pops his head up, and it's called the Omicron variant. And so now we truly do have a winter of discontent, but we should celebrate our progress because of the work that we've all been doing. And I won't just say those of us on the panel, but all of us have been doing to get the word out, to protect ourselves. We can breathe a little easier these days. And to that end, we've assembled a panel of true experts and esteemed colleagues of mine in the field to have a very candid conversation about exactly that: vaccines, variants, kids, as you saw in the cartoon, the lions, the tigers, the bears, oh my, everything about COVID that we need to know, and with current updates and information on where we are. We have Dr. Ronald Andrews, who is a colleague. We're in residency together, a board-certified internal medicine and pediatrics doctor, MedPeds. Dr. Andrews, welcome.
Thank you. Glad to be here.
We have Dr. Corey Hebert, another esteemed colleague, and I've known both of these guys, these two, since I had hair long ago. Dr. Hebert is the chief medical correspondent and medical editor and correspondent for Black News Channel, and chief executive officer for Community Health TV and College Health TV. He is a practicing pediatrician. Both of these guys are extremely busy these days, as we all are, not just talking, but seeing patients. Every time I talk about Griggs, I'll call you back. I got to go back to the hospital. Welcome, Dr. Hebert.
Thank you, Eric. It's good to be here.
We have Dr. Michael Lenore. He's an allergist and past president of the National Medical Association. Welcome, Dr. Lenore. Good to see you again.
Thank you, sir. Good to be here.
Dr. Obina Naidu, who is here in New Orleans. He's an infectious disease physician here at Ochsner Clinic Foundation here in New Orleans, Louisiana. Always a pleasure to see you. Maybe I need to grow a beard and look like you. Yeah, maybe it'll hide the fat. I don't know. That's a good luck. It's good luck. It's good to see you.
Good to see you. Happy to be here.
And again, Dr. Dominic, we have Dr. Dominic Mack. He's a professor in the Department of Family Medicine and a director for the National Center for Primary Care. He's a director of the National COVID Resiliency Network and Morehouse School of Medicine. Welcome, Dr. Mack.
Thank you, Dr. Griggs.
So, gentlemen, before we actually get started, I really want everyone to if you can screenshot this picture and save it on your phone and post it out and carry it with you to show people that we really do exist. We have 6 African-American male doctors at the forefront of the COVID-19 pandemic. And I'm telling you, I'm smiling from the inside like my grandmother was. I'm smiling. If I had more teeth, I'd show them all. And I'm proud to be a part of this panel and a part of this army at the forefront with these experts. What I'd like to do is I'd like to start off, and I'll start with Dr. Lenore, because I'm looking on the screen, Dr. Nadu, Dr. Andrews, Dr. Mack, and then we'll finish with Dr. Aber. I'll give you like about five minutes, or Dr. Mack will go last because you have resources. I'll give you about 5 to 10 minutes just to talk about COVID-19, the variants, the vaccines, where we are now, in your perspective. And of course, if anyone should have any questions, I'm assuming we'll be able to answer them in the chat. If not, I got a million of them because I heard them all. Dr. Lenore, if you'd like to start us off.
Well, thank you so much for having me as a guest with 100 Black Men. I was pleased to hear the discussion. When I was in 100 Black Men, between the new leadership and the old, I don't think that's changed very much. But I would like to say that we're very early on in this pandemic. Anybody who thinks we're near the end or the end is in sight is being somewhat unrealistic. I think we have to go back to the days, and I'm probably the only one who can do that, before we had some of the vaccines that we have now. Certainly polio and meningitis, variety of different vaccines when people were very sick. When polio vaccine was introduced, there was no political climate for a polio vaccine. There was no hesitancy really, and there was no organized movement. But it took us 50 years before we were able to eradicate polio in a very comfortable environment. I think what we're seeing now is politicization of this whole process, which prevents large numbers of Americans from being vaccinated. I think this whole issue of herd immunity is an illusion. I think it's not going to happen. We may have herd immunity in your community, but there's a world community out there where some vaccination rates are less than 5%. So this virus will be around for a while. The other thing is that let's not get comfortable with the new variants, because there will be newer, more sophisticated variants, each one of which may have a different potential for causing disease and death, and each one may require a different response. So I think we're very early in the game. I think all we can do now is to continue to discuss this issue with our community, talk about hesitancy, talk about try to get the facts out there, but it's a continuing discussion and will be, I think, for a number of years. So I think we just better be prepared to live with a change in our lifestyle, to live with a change in our approach to how we manage infectious disease. And certainly we're not, as I've said, anywhere close to a perception that this is going to be over and everything's kind of going back to normal. It's just not going to happen.
Thank you, Dr. Lenore. Again, I'm going to let everyone present. I'd like for everyone to present, and then we'll fill up questions for each of you. Next up, I think in my order, was Dr. Andrews.
All right, good evening. And I am also grateful to be here with the 100 in this presentation, and equally proud, Dr. Griggs, at our panel that you guys have put together. If I could echo in my opening remarks, I'm similar to Dr. Lenore. I think first and foremost, I've had the opportunity to be appointed by the governor of Louisiana as the chief medical officer of Bring Back Louisiana. So I've had a front row seat in Louisiana's response. One thing that Louisiana, we always seem to be first or last in everything. And in this case, we got to be first twice, once for something good, once for something bad. If y'all recall, as we approach here in Louisiana, Mardi Gras season, Louisiana became the epicenter of the COVID-19 pandemic. And at one point, over the course of the summer leading up to the summer of 21, we were actually number one in hospitalizations in the country. And we've actually reversed that since the late fall and winter. But we actually, some hospitals actually, maybe Dr. Nidu could comment on it, got down to 0 COVID admissions, which I think was really awesome and something that we can be proud of. I think that it takes all of us, as Dr. Griggs already mentioned. It's not just the panel, it's not just the doctors and nurses and respiratory therapists, or epidemiologists, it's the population that has bought into, we have to mask up, distance, and also become vaccinated and boosted if that's what's required. What I would echo with Dr. Lenore, what he was saying is that, yes, this pandemic is here. This virus is going to be around. It's going to continue to mutate. And right now we're in a cycle of people getting their first vaccinations as we got down to the children 5 to 11. We have the senior citizens and those over 18 who are, if they were the early adopters, now getting boosters. You have those that are waiting to get their booster vaccine. So we're all in different phases of vaccination. And similar to what Dr. Lenore was mentioning, that lends itself to this virus continuing to stay around, thrive, and mutate, because we're all at different stages. And those that got the first 2 vaccines but may be hesitant to get the booster, then they no longer have that protection. And we end up in this vicious cycle. What I hope is that we can all continue to hopefully depoliticize this pandemic and understand that it's science. At the base of it, this is all just science. And the quicker we all understand that and can get on board with the plans, the better we'll be off as a nation and ultimately the world. And I'll yield there, and thank you for having me.
Thank you, Dr. Andrews. I really would like to echo that. It is just science. It's that subject that most people don't like. Science and math, they don't like, but we all chose. I can't even count in a centuries, the amount of experience that we have on this panel in the sciences. So it really works when you let scientists do what scientists do. Now we've heard from Dr. Lenore and Dr. Andrews, and now we'll hear from Dr. Naidu, who is an infectious disease. Let me tell y'all, he chose to study bugs, and when I say bugs, I mean viruses and bacteria. Long before COVID made it cool. So he knows a lot about it, and if you can just tell us your perspective, give us a little history, we appreciate it.
Yeah, thank you so much. And again, I'm really excited to be here. I'm really excited to be amongst peers, colleagues, physicians, scientists that look like me. I'm here in New Orleans. I work at Ochsner Medical Center down here in New Orleans. As was alluded to, we were down here in New Orleans, we were an early epicenter, if you will, for COVID after the Mardi Gras celebrations last year. And I really, really, really saw the impact it had on our community, both health-wise. I'm sad to say I lost a number of patients of mine, patients who I had for years, some who had become friends even. And the impact it had in terms of our population, impact it had in terms of healthcare workers trying to deal with the sudden surge of patients that kind of slammed into our hospitals, if you will. And so I was one of the very first people to get a vaccine in Louisiana. I remember the governor of Louisiana came to our institution when the vaccine, it was Pfizer that was the first one that was available here. And I was extremely happy to get the vaccine. They asked me if I would be on TV. I was like, yes, that means I get my vaccine right away. And part of that is just my knowledge of the research that went into the vaccines, the safety data, as well as the efficacy data as well that went into the approvals of these vaccines. I think that there are a number of strategies that we have to be able to live with this pandemic, or basically live with this virus, safely. Vaccines are an important tool to that. Masking and social distancing are very important as well. I agree with the earlier speakers in the sense that, I don't think herd immunity will ever necessarily be achieved. The virus is always going to mutate slightly. And so I think what we're moving more towards is living with this virus in the way that we would normally live with other viruses, like the influenza virus and other respiratory viruses. And for that to happen, we need to really, really, encourage vaccination in our communities. What vaccines do, they don't necessarily keep you from getting infected, although they do. When you compare vaccinated people to unvaccinated people, vaccinated people are less likely to get infected, but they can still get infected. But they're significantly less likely to be hospitalized, and even more significantly less likely to die. And that's really the benchmark. That's really the metric. We want to keep our people happy, alive, and safe. And so, and the second thing I just want to say is, unfortunately, with this virus, it's not something where, let me do my thing, you do your thing type thing necessarily works. Some of us get vaccinated, but a lot of us don't. There's still the potential for the virus to circulate, and there's still the potential for the virus to mutate in particular, and for new strains to end up coming up. So we really need to get most of us, really thinking about getting vaccinated, or really just getting vaccinated, in order to sort of decrease the transmission of this virus and get to a point where we can live safely, vaccinated, and protected from the severe outcomes of COVID. Thank you.
Thank you, Dr. Nadeau. Folks, that's coming from directly an infectious disease doctor. Again, I don't think any of us saw anything of this magnitude coming. Next, I'd like to bring up my colleague and friend, Dr. Corey Hebert, who's been at the forefront of all of this, literally, from the health communication side, nationally, locally, on the clinical trials, you name it. Dr. Hebert, welcome.
It's good to see you, and glad that everyone was able to join. I've known these guys on this panel for a while, and it's humbling to be on the same panel with them. So thank you guys for allowing that. I have always a little bit of a different kind of thing that I like to talk about with anything, but it's always something different. So COVID-19 has been a real bear for the nation and the world. It's a pandemic for a reason. It's called pandemic for a reason, rather. But I just want us to just kind of step back, because this is an organization that deals with Black people. So we have to kind of deal with this from a Black point of view because of our viewership. And I'm the chief medical correspondent for Black News Channel. And so I've been having to look at this from the Black lens, even though I have to do it from every lens for the general population. I have to look at it from a Black lens. And what this has shown is that the social determinants of health that make it so that we don't do well, it has put a beacon on these problems. And we don't like to say, health disparities anymore. We like to say health inequities, because these things are unequal. When we talk about, where you live, where you love, where you work, and where you play. And so one of the big things that Dr. Fauci came out to say at the very beginning of this whole thing was like, this was going to shine a light on a lot of the health disparities. And so the first thing I corrected was, it's not a health disparity, because disparity just means difference. The weather in Alaska, there's a disparity between the weather in Alaska and the weather in Miami. But it doesn't mean that one is bad and one is good. So we shouldn't let people off the hook by saying disparity. We need to say inequity, because it is not equal. Their healthcare is good and ours is bad. But he said that it was going to shine a light. And what I disagreed with is that it's not going to shine a light, because we've been shining a light on the health disparities, quote unquote, that he said, health inequities. We've been shining a $2 billion light on this for the last 30 years, which means that the light's been there. It's just that the wrong people are shining the light. We need to have a beacon, LED beacon, with the right people at the table holding the flashlight. because what has happened is that, just because somebody has MD behind their name or PhD behind their name and they look a little brown, you put them at the table at the federal level and you say, okay, tell us what's wrong. And obviously our blood pressure problems are going up, our diabetes is going up, let alone our COVID-19 issues. So what we have to remember at this point is that COVID-19 has been one of the worst things that has happened in the world since we've known it. But the reality is that what it is doing is showing that we as Black people are resilient as hell. That's the first thing. But the second thing is that this must stop. The ability for us to not have the things that we need to be, happy, healthy people. We can no longer allow these inequities to persist. And so what I want people to remember is that that's my first thing, that we have to do more, and we have to start looking at the things that are causing all of us to die from COVID-19. It's not necessarily just COVID-19, it's the fact that we have all these pre-existing illnesses and coexisting illnesses that make us have a lot more mortality. The second thing is that we as Black folks, we got issues. We got real issues. And we don't want to get this vaccine because we say, oh my God, it just happened too fast, right? That's an issue. Because I just did a lecture in Los Angeles last night about the meningitis B vaccine. Meningitis B vaccine, we give it to everybody going away to college right now. It's a big deal, been out. But that vaccine was an emergency use authorization vaccine. An emergency use authorization vaccine, but nobody thought about it. Nobody cared about that it was emergency use vaccine. You know why? Because people weren't sitting at home worried about it, looking at what the FDA was doing. COVID-19 vaccine, the reason why people are so upset about it, especially Black people, is first of all, Trump had something to do with it. The second thing is that they were sitting at home. We were sitting at home watching the development of this thing. And they were like, what is going on? How can this be? What is all this? This can't happen. But we didn't realize, as Black people, that this happens every day. So the ego for people to feel like they can watch a Facebook video and then know what happens and why this mRNA is not something that just we pulled out of a hat somewhere to give vaccines. The ego of us as African American people is kind of a bit much to think that, I am a postman or I am a teacher or I am a engineer, and so I understand vaccinology. So what we have to do is really get to the core of, we're not getting vaccinated because we're scared, we're nervous because of historic distrust. And until we address these things in a way that Black people can trust so that they can get vaccinated, we can get vaccinated as a group, we are going to be behind the 8 ball, because white people are vaccinated and they're opening up the world. And what's going to happen is the people that are going to die are the people that have been dying the most, and that's African Americans and brown people that are poor. So with that, I will yield back to the group.
Quite well said. Excellently said, Dr. Hebert. And that's going to lead to you. Actually, it's a segue. We got to hear from Dr. Mack, but it's going to be a segue to talk about our experiences and the things that frustrate us the most as doctors and as beacon carriers trying to sound the alarm in our communities. Dr. Mack, if you could, please, we would love to hear more about, we always talk a lot. My grandmother said, don't come to her with a problem unless you have a solution. Mama, I spilled the milk. Did you clean it up? What you gonna clean it up with? With so much disinformation out there, resources and what we should think. I'd love for you to touch on that as you address our audience.
Thank you, Dr. Griggs, and thank you for the invitation, this esteemed panel. Can I share my screen? Hello? 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 Am I frozen? Is it me? Am I frozen? Okay. I can't. Do I need to call back in? Because I can't see anybody. I'm sending a request to share screen. Maybe I need to call back in. It's not taking me share screen. Should I just come back in? Okay, I'm not going to leave, but okay. Am I coming back into the room? I just see myself. Is everybody hearing me? Oh,
Yes.
okay.
We can
Okay,
see and hear you.
I was in the twilight zone. I didn't see anything, man. Okay,
so folks, what he was doing was he was just giving an example of the fact that we're all in this together. You were not alone, and y'all are not alone. We're right here with you.
Okay. Okay. Well, I'll quickly. I can't share, but let me just talk about and I'll talk about. Dr. Hebert talked about the social determinants or the determinants of health, and I just want to start with that to expound upon his points. Healthcare is only, you hear sometimes 10 to 20% of your health. Getting the vaccine in your arm, there's a community issue that we deal with before you ever get that vaccine. How do we get people to get the vaccine? What barriers do we overcome? And that's the partnership we've had with the National COVID-19 Resiliency Network and the 100 Black Men to address the messaging that is needed within communities. One of the slides that I had kind of shows an African-American walking through the community. And basically what we have to do is we have to connect the culture, which can be different among communities, even within African-Americans. We have to connect the culture and what is the information that's being circulated in particular communities. We're talking about vaccinations for children now. If you have an adult who doesn't want to get vaccinated, you got a house full of children who are not going to get vaccinated either. So the work we've been trying to do together is how do you engage communities in what we call formative research to have surveys and focus groups and just listen to the information why they won't take the vaccine, develop messaging, and then test that messaging to overcome those barriers. And that involves using community-based organizations, engaging community-based organizations. And one of the things we haven't done in this country is distribute the funds to those community-based organizations. You hear the word, we parachute in and then we leave these communities. Even when we do this research, we need to enable communities because the knowledge is there. We have community-based organizations who understand these communities better than any academician. But how do we begin to distribute funds? How do we begin to make them the researchers? And that's part of this COVID-19, with all this funding out there. We bring the conversation that we need to put the funding in the hands of the community to develop the proper messaging, to overcome these barriers, to make sure we can get people into vaccinations and get people into care. One of the things that's happening now really in the African-American community, the uptake of the vaccine, we're improving. Like Dr. Hebert said, we have a long way to go, but this politicization of the vaccine is it's impacting the white community right now almost as much as more than it is us, because we're starting to take it up. So we've always said all you have to do, if you put some interest in the community, hear the community, and respond to their needs, they will start to respond. And I think we're seeing some of that now. Thank you.
Thank you, Dr. Mack. I think what I'd like to do is open it up. I think all of you have touched on very salient points. I want to ask specifically, Dr. Lenore, you mentioned herd immunity. Part of the confusion in this whole process was the terms, our public health and our healthcare terms. You said that we will not get there, and I'm in agreement with you, actually. Can you explain for our audience what that means and why we may never get there?
Well, herd immunity suggests that if you get enough people vaccinated, that the virus will not have any place to live. I think we've been spoiled as an African American community because we've been able to debate immunizations for a long time. And our immunization rates have never been what they should have been because so many other people were vaccinated around us. Well, that's not true here. And I like to set a different tone. How much information do you need to make a decent decision? I mean, we can talk about the wrong messaging. We can talk about a lot of other things. But I think I agree with Dr. Hebert about a couple of things. One is herd immunity is just an illusion. It's not going to happen. I think the other thing is that, they're going to forget about us. We're hot right now. Everybody's talking health equity. I don't care what you call it. But if you ask 4 people, who was that man that got killed in Wisconsin? 4 white people are not going to remember his name. And in a year from now, we'll be right back in the same situation. So if we're to reach herd immunity, it's not going to happen from the top down. It's not going to happen with messaging. It's going to happen from the bottom up. And I would just say this as I've always said. If we got as mad about healthcare that is so poor in quality and unequal, as Dr. Hebert said, as we do when somebody cuts in front of us in the Safeway line, we wouldn't have this problem. But I'm at the point now where I don't know how much more messaging can you give? How much more science can you give to people, half of whom who never took a science class? I think we got to come up with a more creative strategy. It may not be the one you like. It may not be tolerant, may not be sensitive, but it has to be different.
Thank you, Dr. Lenore. Dr. Andrews, you talked about being here in Louisiana, and we've been number 1 for good and bad reasons. Now, can you talk about what we all remember the bad? At one point, we were number 1 in the world for new incidents at the very beginning. We didn't know what was going on, but we got a lesson in how to respond to a fire. What can you attribute our successes to? And then what trends have you seen that might concern you about falling back into that bad pattern? Does that make sense?
Yeah, definitely. I think, Dr. Griggs, one thing that we did really great here in Louisiana is that, and I will say, and it was in the bio that was put out, I actually grew up in Texas and am licensed in Texas, but we actually were able to ignore our neighbors. So we have Texas on one side and we have Mississippi on the other side, and these are quote unquote red states. Our governor happens to be a Democrat, and we do want to depoliticize this, but Louisiana went all in really with New Orleans leading the way with being, mask separated. I mean, can you imagine that we closed down Bourbon Street? I mean, in the years that I lived there, Dr. Griggs, you and I know we're probably out there too much. But for Bourbon Street to close down, I mean, that just, other than what Mardi Gras night, I think that is the only time in a 24-hour, 365-day year, 366, add the leap year, Bourbon Street doesn't close down. But New Orleans led the state in closing restaurants, closing down, outings and big events. And after Mardi Gras, I think that set the tone, for most of the state, or at least the very populated areas. And I think that was great. And again, ignoring our neighbors and obviously the federal administration at the time in having mask mandates and keeping those mask mandates in place for an extended period of time. I personally wish they were still more in place right now. And I'll get to that as some of the things that we get lax about. But I wish we would have kept those longer because that could greatly help. If you look at it, I'm in Baton Rouge currently, but if we go back to New Orleans, we just had the Bayou Classic. And I've been invited to multiple weddings that in New Orleans. I mean, New Orleans to this day, for all of those listening in the nation and we're international, New Orleans still makes you bring your COVID card, whether that's electronic, a picture, or your actual card in your hand, if you want to enter a restaurant or venue where it's going to be, a congregation of folks. So I think those things are really important. If I would piggyback again on something Dr. Lenore mentioned, is that one of the things, and I don't know other states that did it, they may have, Dr. Lenore, we ended up paying people in something we call shot for 100, that if you are willing to get a COVID vaccine, it was your initial vaccine, that you got $100 is how it started. Now, some of the flack from that, Dr. Lenore, was the early adopters, they missed out on that. So anybody who was like Dr. Nidu, who was like, put me on TV and I'll get my vaccine, he did not get that $100. So he was already fully vaccinated by the time that that could have been available to him. So it started out as shot for 100, come get your first shot at a participating location, right? Secondly, it was just your first shot, and they would preload a debit card for you just for getting your one shot, clearly give you a appointment for your second shot. That ended up getting extended multiple times now, and actually is for your first or second shot. You can't get $200, but if you're caught in the middle, as I was explaining about Dr. Nidu's type situation, if it's your second shot, you can now get the $100. They originally tried to give students that were under 18 a voucher for some books or something like that. And because we want to reach all communities, that did not bode too well. So now the new term is just a shot for all y'all, is what they're calling in Louisiana. So anybody, a 5-year-old, and I hope their parents let them keep it. Christmas is approaching, but a 5-year-old goes and gets the vaccination, they get a $100 debit card as well. So I don't think that is the only approach, but any of us that have been at health fairs or any kind of functions where we're trying to promote good health, you always have to know what are your giveaways, your freebies and your giveaways, because people wanted pens, pencils, back to school supplies, a book bag, whatever it is. And I think that I do applaud the governor here for making a way for that shot for 100 to exist, because I'll tell you, we had, I think it was Dr. Mack mentioned that, you have to bring it to the community. And we had an event last Saturday at Mount Pilgrim Baptist Church, right near Southern University's campus in North Baton Rouge. And I'll tell you what, we had the shot for 100 there, in addition to other organizations promoting health. And we gave out 325 vaccines in like a 4 or 5 hour period. But it's similar to what you're saying. They knew it was going to be brown faces that resembled them. There were organizations that they were familiar with that were there in agreement with us, in addition to the pastor of the church. They had a lot of the Divine Nine, as they say, the Black Greek letter organizations, Jack and Jill of America, and on and so forth. And 300, people were lined up. The event started at 10 a.m. People were lined up at 9 a.m. in line to register to get the vaccination. I want to say a day before, 24 hours before the event, it was only 75 people who went online and officially registered. But at the end of the day, I told you it was standing room only, and it was over 325 vaccines given. And I think at least 200 of those people were able to get the $100 because it was their first vaccine. So I think that was really great. If we start talking about backsliding, Dr. Griggs, I think the one thing that has irked me the most is as we relax these mandates. And I'm not saying we're going to mandate our way out of this pandemic, but every time we've relaxed the mandate, whatever it might be, masking, the separation, venues, restaurants, and I am sympathetic to the economy and small business owners and large as well. But we can never go back. It's like once you let Genie out of the bottle, we've never been able to come back and say, okay, well, starting January 1st, we're on lockdown again, or we're on mask again. It's like from lockdown to mask to the closing of, extremely crowded venues, is no way to reverse that pattern. It just in the way our society is going right now. And that's what I most fear.
Thank you, Dr. Andrew. Spot on as always. And I think those of us on this panel with you would echo the frustration every time we relax. We have a term in our community we call doing too much. They relax the restrictions. We go out there and Dr. Abe, I'm coming to you after I go to Dr. Nadu because I'm saving that. I'm special for that.
Don't do it.
I'm gonna do it. We tend to do too much. But before we get to you, Dr. Abe, I want to go with Dr. Nadu. I would be remiss. There's a big elephant in the room, and we all see it. And I would be remiss if I did not bring it up. Dr. Nadu, as our infectious disease expert, I'm just gonna ask you, like the dude asked me today. Say, bro, what that Omicron is? What is Omicron? And Dr. Lenore said, we're nowhere near out of this, and expect more to come. Let's talk about Omicron and just give us your perspective.
Yeah, so just to be clear, since the pandemic, there have been multiple different variants. Many of these variants don't become what we call variants of concern. So many of them don't become major public health population level problems. But the virus kind of has small mutations, and occasionally a series of mutations will make the virus become a variant that is of concern, that is causing, or has the potential to cause, relatively significant population level problems. And so with the Omicron variant that was first reported in South Africa, we don't fully know exactly where it emerged. It has a number of mutations in that spike protein, which is a key protein that the virus uses to access cells. Has a number of mutations that raise a lot of concerns. Plus, when the Omicron variant, started spreading in South Africa, it was at a time when South Africa was actually having relatively low rates of COVID. And so they noticed an uptick, and sometime, early November, they, did some sequencing and determined that this was a new variant. It appeared to be spreading, and they alerted the World Health Organization as such. So we're still learning more about this variant, and so it's hard to give really hard, definitive answers about it. The few things that we know so far is that it appears to spread quite rapidly. The early data is showing that it may spread a little bit more efficiently than the Delta variant, which we all know spread relatively well. It also appears that although the virus has mutated in a way that it spreads more readily, it may actually cause less severe disease. Again, we need to wait and get more data. We need to see, as more people get infected, we'll be able to make a stronger determination. But the early data suggests that it spreads more rapidly. But in terms of actual, severity of disease, it's definitely not more severe than Delta, and it may possibly actually be less severe in terms of the severity of illness. And the other question is, what about immunity from natural infection? And I would just make a quick caveat because I suspect people have questions about this. Natural infection immunity versus vaccine immunity. From the information that we have at the moment, vaccine-derived immunity still seems to be better than immunity from natural infection based on just the data that we have up to now. Now, when someone is naturally infected and then they get the vaccine, based on measurements of antibodies, which is an aspect of the immune system, it seems to actually give an even better immune response. And so what it looks like, what the early data from South Africa is suggesting is people who were previously infected can still get infected by this new Omicron variant. And we still need to get more information about the vaccines and the efficacy of the vaccines to this new variant. Based on what we sort of know about the mutations and about the virus, it's likely that the vaccines will still protect against hospitalization and death, but we'll have to see how much the vaccines protect against any infection, be it mild or whatnot. Pfizer just came out with some new data showing that with the booster, when you get your 3-shot booster, when they take those antibodies in the lab and run those antibodies against this new variant, it still seems to neutralize the variant. And so that's encouraging early news from Pfizer, and the other vaccine makers are doing similar studies. So to kind of summarize, the early data is suggesting that this variant spreads relatively well. It's not more severe than previous variants, and we'll have to see. It may be less severe, but we'll have to kind of get a little bit more information. And vaccines will probably still protect against hospitalization and death. We'll have to see how much protection the vaccines give against any type of infection.
Thank you, as always, for making the bugs less scary and making them sound a little bit cool. Dr. Abair, my friend, you knew I was coming. You tweeted out earlier today. There was a tweet, you said, expect a lot of infections from Omicron and Delta. A lot of people might not understand what you mean when you say that. So I'd like for you to address that. The other thing, though, and this is the special part, I want you to talk directly to the parents about the kids that might be on the fence about getting vaccinated, the benefits thereof. And then I want you to talk to the general public, and what would you say on a national level to any governing body on how we can help get out of this?
Oh, that's a multi-level, multi-factorial question, Dr. Griggs, but I'll take a chop at it. So basically, this is what it is. And this is the world according to Corey Abair here with a lot of science behind it. I really feel like right now we are in a tipping point because as Dr. Andrews said, we have had a lot of chances to get out of this thing. But, I always go back to my adage, that public health is a 4-legged stool. You got public outcry, you got science, you got money, and you got politics. And science should be the number 1 leg, but it's usually the number 4 leg. Usually public outcry, money, and politics far outweigh science. So we all know it would make perfect sense for us to, in July, when they released the mask or rescinded the mask mandate and said that if you were in your home and everybody was vaccinated, nobody had to wear a mask. They did that right before the 4th of July, right? That was a horrible decision in my opinion, because basically what it meant for people that are non-scientists, it meant that it was over. So everybody went around right when Delta was coming out and then just had their 4th of July celebrations, and then Delta hit. Now, Delta was already out, but it was very contagious. So people just took their masks off and they just kind of went about their business. And sometimes I feel like I've been called Negro Damas here recently, because these things that we talk about, all of us that are sitting in this panel have said these things from jump, meaning why on earth would the United States open up the borders with the Delta variant still swirling around the world, open up our borders right before Thanksgiving and Christmas? So everybody from Europe and everybody else that is having these high spikes of COVID-19 infection, why would we do that? That makes no sense. Once again, so now open up the borders, Macy's Thanksgiving Day Parade, everybody in the world is in New York, and what happens? Spread everything else around the United States, right? And then we did a very racist thing by stopping the countries that identified the Omicron variant, not the countries that started it, not the countries that had it first, not the countries that had more of it, like the Netherlands and every other European country. No. Those countries did not get sanctioned. They can still come and go as they want. But the South African countries, including South Africa, those countries were sanctioned and have not been able to come into this country. So we have a very serious lens here that people are looking through to say, you know what, why should I get vaccinated? It seems like, this country doesn't like the fact that I'm Black and other countries around the world are Black, and we've had vaccine apartheid around the world. That's why we have 3 shots here in the United States and people in Africa don't even have 1. So where do the variants come from? Other places. So this is a pandemic, like I said at the beginning, it's a pandemic, so we have to do for the world, but we have not done that. So where we are now is that we have a circulating variant called Delta, which has wreaked havoc, still not gone. We have a new variant called Omicron circulating, still not gone. And then we have Black people in America who refuse to get vaccinated so much that our rates are worse than some parts of Africa. And then we don't get our population vaccinated, so we're the ones that are going to die. So the second part of your question, Eric, is what do I tell the kids? What do I tell the parents? Well, you had Christmas time coming up, and if you got out of Thanksgiving, all right, hopefully you had sweet potato pie, not pumpkin, okay? If you got out of Thanksgiving alive, okay, and your family got out alive, then when Christmas time comes and your children didn't get vaccinated, your grandmother may have cancer sitting at that table and nobody knows. Somebody might have multiple myeloma like Colin Powell had, nobody knows. Somebody might have an autoimmune disease at that table and nobody knows. And your kid, who is one of the largest super spreader nitises in the United States, children, even though they don't really get sick, one of the largest super spreader nitises in the country, are going to be sitting around that table, playing, eating, doing all that stuff, and unbeknownst to you, giving the Omicron variant or the Delta variant to your elderly person or your person that has an immune compromised state, and then kill them. Okay, that's the only thing. I have to be very blunt about these things. That could happen, and we are losing a culture, folks. We're losing a culture. We are not going to have the stories. We're not going to have the music. We're not going to have the recipes and things like that from our culture, because so many of us are dying. And one thing we don't really know about the Omicron variant, because a lot of them are the people that have been hospitalized or that have gotten it have not really been immunocompromised that we've seen. But what is the Omicron variant going to do to immunocompromised people, elderly people, and people with pre-existing illnesses like African-American population? We don't really know that yet. And that's why what you must do is this: wash up, mask up, separate, and vaccinate. That's what you need to do, okay? The virus can't get through an N95, and the virus can't get through a face shield. Keep your hands washed, keep your distance, and do those other 2 things, like I said, and that's how we get through this. Don't get me wrong. We've got to get vaccinated, but we've got to do all of it. We used to, remember when we were trying to flatten the curve? Remember, we wouldn't even bring groceries into our house without washing them off and leaving your shoes outside, everything like that. But then we just got lax, and we cannot get lax because the people that are going to die are us. Now, Dr. Griggs, you asked me, what would I tell the government? Quit following politics, quit following money, follow the science, and we'll get out of this. But if we continue to do the things that open up the financial highways in the United States for us to be able to make money. Don't get me wrong. Just like you, Dr. Griggs, I feel, and Dr. Andrews, I'm the same way. We understand commerce. We got to have it. But there's no reason why we should open up the borders when we have circulating variants. And there's no reason why we should lift any mask mandates. And I'm for a 100% vaccine mandate for the country. That's what I am for. That ain't going to happen, but I think it should.
Thank you, as always, Dr. Hebert, I knew what to throw at the rim and you dunk it. Dr. Mack, got to come back to you to talk about resources again. You use the term CBO, and a lot of people talking about CBO. Man, I don't know what that is. Break it down for us. Where can people look? Where should people look for information? Where should they look for help? And what can they do to help themselves most? Oh, and of course, please address the boosters.
Yeah. Well, CBO, community-based organizations, forgive me, but basically organizations that are in your community that actually touch the people have been very effective, and that's part of the messaging. Look, everything, and Dr. Hebert touched on this, there have been multiple infectious diseases that we routinely, when you take your kids and we go to the physician, the polio, the MMR, all these vaccinations that we get, they come from what we call three things, triangulating on success with every infectious diseases. It took the innovation, like the invention or the discovery of the vaccine. It takes public health to actually get the information out. And then it takes the clinical component. And we have the same issue with the variant. And what we tell parents about the kids, but also about themselves, you're taking the polio vaccine, it was once like this. You're taking the flu vaccine in the past, you're used to that. It was once like this. It may have not been a pandemic, but it was an epidemic. So it's very important that, yes, Dr. Hebert just gave a great message. And when we say messaging, we mean that in multiple ways. Dr. Andrews talked about there were people of the same color with the same message to a community. And that basically it enhances the community to come out. People saying the community doesn't know science. Well, if you look at the beginning of this pandemic, what were the scientists saying? It was confusing. Even the best science, if you listen to science, if you listen to your politicians in Georgia, if you listen to your governor, if you listen to your president, and then you listen to some scientists who were basically in public health, they were giving mixed messages. So the community was confused. So it's not just they ignorant, they're still thinking about the Tuskegee study, which that's part of it. But some of it is, hey, we're listening to what people are telling us. So we have to overcome that. So resources are available. Sometimes not the best resources, but you can always access public health within your state. You can access the CDC, NIH. You can just Google these things. And then, of course, the National COVID-19 Resilience Network. This is not a commercial, but we'll give you that information hopefully before we go off the air. But basically, what we're trying to do is encourage people now to take the booster, which is important. And Dr. Nindu can tell you about the effectiveness of that. So I won't go into that. But also on our website, what we're trying to do in coordination with the 100 is to make sure that patient can actually go on the website and they can put their zip code in there and they can find resources within their area. That's vaccinations, testing, a physician, mental health resources, and we're actually bringing on board determinants of health, or social determinants of health, food insecurity, where to find a job, and those type of things. But if you can't, that's ncrn.com. But if you can't do that, go to your public health, go to CDC, and they have information that you can access. But also, best of all, go to your local physician, go to your local African-American physician, your primary care physician, the docs that are here on the call, and they can tell you what to do. Thank you, Dr. Griggs.
Thank you, Dr. Mack. So again, we're talking about the winner of our discontent. We're talking about vaccines. We're talking to our population, Black folks. Dr. Hebert doesn't know I'm going to do this, but I remember it was almost 2 years ago where you gave a history of vaccines from an African perspective. How can you enlighten us? Share with us the story about vaccines, where it came from.
Oh, well, that's a very interesting story, Dr. Griggs, and it's actually one that's on the Discovery Channel. I narrated that. So if you want to actually show that to your patients, just go to Discovery Channel and type in Onesimus, Onemius, Onesimus. And basically, Onesimus was a slave of Cotton Mather, who was a man of God who actually held slaves in Boston when they were going through the smallpox epidemic. And when he started seeing people dying and his children, where he was nervous, Onesimus came to him and said, hey, Massa, we used to do something in Africa where if somebody had this disease, we would rub like a stick on their open wound and then rub it on ourselves before we actually got it, and we break the skin, and then those people wouldn't die. And he was like, what? That doesn't make any sense, you silly Negro. Go about and finish baling that hay. Well, anyway, people started dying more, and he told him again. And then Cotton Mather said, okay, you know what? I don't want to die. So he tried it, and it worked. So then he went to lots of folks around Boston, and people actually started doing it. And those people, he saved basically untold lives. It's fast forward to the 1800s, late 1800s. A white physician decided that he wanted to try this whole thing because it was called variolization, because they used a different virus as the nidus, as the vector. And so they used it, and then it actually worked. And they used cowpox for that, variolization, cowpox, so that you wouldn't die if the experiment went bad. And so they used cowpox, and then they showed that you had immunity to a disease. If I took somebody with the disease, it took their blood and put it in you. And so they called it vaccination because it was used by the cowpox, which is cow is the vaca is the Latin word for cow. And they used that to start the word vaccination, and that's where vaccination came from. And so if you go to Boston right now, there's a big monument to Onesimus as the father of American vaccination. So when Black people understand that we invented vaccination, just like we invented math, invented science, invented medicine, invented civilization, invented everything, then maybe we'll feel a little bit more open about it and say, maybe, this is what we do. We wake up in the morning and breathe excellence. So we shouldn't think that we're not the ones that invented vaccination. So there you go, Dr. Griggs.
Yeah. So again, if I had teachers like the people on this panel, I probably would have gotten even better grades. No telling where I'd be, right? Thank you for that. What I want to do though, I want to, Dr. Lenore made you actually touched in emotion that I think all of us that are here on this panel struggle with. It's frustrating going back and forth. I think people do it as a game to try to argue with you why they don't want to get vaccinated or why the science doesn't make sense, to the point that I think that we walk away. Now, the thing is, I just want to ask, what advice would you give someone that's on the front line, or all the gladiators or the in the arena with us, to educate and to continue the work in the field, dealing with that every day, that pushback?
Is that for me? That question for me?
Absolutely, because it sounds like you fired up about it.
No, I'm not fired up necessarily, but I have a California experience that I'd like to share with you. I practiced allergy only for several years, and then I got bored with just doing that. So I've had a pediatric practice for a very long time. And so we've been discussing immunizations with Black families for a long time, who didn't want to get this, didn't want to get that. 2 years ago, the state of California said, you can't do anything with your children unless you're vaccinated. Nothing. You can't go to the store, you can't go to nursery school, you can't go to school, and there is no exception. And there has been no opposition to that at all. There hasn't been any organized opposition. The people come in here now and they get these immunizations, they don't even talk about it anymore. I think that we have to continue to talk to parents. I don't think there are any more messages. They know about the CDC, they see about these other things, but I think as we continue to talk and they continue to see a groundswell of people who are getting better because they're vaccinated, then I think that's what we have to do. We have to go over the arguments over and over again, and we have to be prepared for, I hate to say, use this term, the long haul. We have to be prepared to continue to talk and let the groundswell of public opinion move some people. I'm starting to see a change here in my area, in my practice. More and more people are seriously considering getting vaccinated. My message is the same, but they're starting to see TV things and other things. I would have preferred a mandate, but that's just me. But we've had mandates, California, for 3 years, and I can tell you, I cannot remember the last time someone objected to getting the routine vaccines. So I think that's a message in that. But I think it's going to take us a long time. Same message, just keep talking, keep talking.
Thank you, Dr. Lenore. And if I can get all of the panelists on the screen, we have about 10 minutes left. And this question is for all of you, actually. We're talking about kids, we're talking about vaccines. And Dr. Hebert, and Dr. Andrews, we were in residence together. I have a thing for the kids. nobody's talking to the kids. In your practices, what are you hearing from the kids, and what advice would you give the kids? Just give some examples, and I'd love that. That's open. That's for each of you.
Can I say this real quick? I'm gonna leave it alone. This little boy the other day told me, "Man, I'm not getting that vaccine. That vaccine killed people." And you know what I told him? Shut up, boy, get this vaccine. It's stuck.
That's exactly right.
That's what happened.
That's what works.
Shut up. The hell you talking about? Shut up. Take this vaccine. That literally happens.
Was it cathartic? Was that therapeutic for you? Did you what do you want to say to everybody?
I'm done. I'm just saying. And it felt good. I just stuck it.
One thing I will say, the average person cannot talk to a parent about getting a children vaccine. I think you have to have a special relationship with that parent that you've earned over years and years, from the time they were in the delivery room until the time they went to high school. I think more of us who take care of children have to get in the game and start to talk. Our children are upset because they keep getting sent home for another test. If they even look the wrong way, they got to come home and get another test, and they want to continue in school. And so we're starting to see children not so much resistant. But I agree with Dr. Aber. Sometimes I say, look, girl, just go get the vaccine. And because I've been with them a long time, that has some weight. So I don't think that the average person can talk to a Black family about vaccinating their children. I think Black doctors who care for these children, who develop these relationships, have to get much more active and engaged in that discussion. And we have to start teaching white physicians how to talk to Black families about getting their children vaccinated.
You better not say "shut up, boy," and take this shot. Do not do that. Do not do that. Anyone else?
No, Dr. Griggs, I will agree wholeheartedly with what both of these esteemed physicians are saying. But what I found is most of the kids want the shot. They have heard about this shot for a very long time. They don't want to get sick. They don't want to spread it to their grandmother or other elderly family member, and they want to get the shot. I've had more that have signed up as much as they'll want to see a needle and take a shot, don't get me wrong, but to get the vaccine because they've been afraid all this time and nobody's talking to them. So they actually, volunteer to get the shot once it was available to them. I've seen kids cry like tears of joy, happiness that they finally got the shot, because I think their parents were keeping them from things, keeping them from their friends and other activities because they weren't vaccinated. And so now they can, and I will say one more thing, piggybacking, since Dr. Lenore told on himself and said he's the only one who will remember these things. And he's probably true. He's probably telling the truth. Dr. Aber, Dr. Griggs, we were in residency together. Dr. Nader looks a little bit younger than us. Most of the routine vaccines I have never seen in my career. In a 20-year career, I have not seen the majority of diseases that we routinely vaccinate against. I mean, and the ones that were developed while we were in training or early in our career, especially in pediatrics, like rotavirus. Rotavirus, diarrhea was a big thing when we were in residency over Children's Hospital in New Orleans. It may be a floor of babies admitted for just that diagnosis at University Hospital. Since that vaccine has been out, I can't tell you in the last 5 to 7 years a diagnosed rotavirus case. I'm saying not that it's eliminated, but it's just that decreased. I may see chickenpox once every 7 years. And when I do see chickenpox, it's literally that they have one lesion on the back, in the hairline, and maybe something in their cheek. It is so rare to see these diseases that we routinely you could get the common ones like tetanus. I know we've been, revaccinating people for pertussis and other things, but you just don't see these things because that's how well vaccines work.
Yeah, no more of those. I'm sure y'all can remember those chickenpox parties when we were kids. You find out one of your boys got chickenpox, your mama send you over there, you can get it over with. Miserable. I'm sorry, Dr. Nader, I saw your finger up. Please contribute. Come to the point.
Yeah, no, I just I'm a infectious disease doctor for adults. I don't see children that much, but in the few instances I have to say that I've had to deal with this, the children are actually more eager to get the vaccine than the parents. and I've had to sort of talk to the parents and kind of get them, comfortable with it and explain the rationale behind it to them. And then there is a question that was just shared on the chat box about, giving advice to people who are just refusing medical advice, just refusing good medical advice. And I like the idea of thinking about this as sort of like a long game, because sometimes you're only spending a half an hour or definitely, or no more than an hour with a patient in a particular encounter. And you just want to plant those seeds about why the vaccine is important, why it's important for our community as Black people, how the vaccines are impacting us. And I try to find out specifically what their hesitations are. I try to get them comfortable enough to tell me what those hesitations are. And I've become more accepting of the fact that sometimes in that particular session, they may not agree to get the vaccine. But I've had instances where they're like, okay, I'll think about it. And then a week later, they ask me, but doc, which particular vaccine do you think I should get? And then I know I'm making some progress, and I sort of, talk to them a little bit more. So I think in terms of individual encounters, thinking about this as a long-term, in terms of groups of people, same thing. If they are hesitant or refuse, don't get angry, just sort of be patient, give the necessary information and the contact information. And that's kind of been my approach.
Dr. Mack, what about you?
Yeah, Dr. Indu just reminded me of a story. Someone who's a friend, but also a former patient of mine, was adamant about not taking the vaccine, and I just continued the conversation. So I think for those who are resistant, we just keep talking to them, especially get someone to talk to them who they respect their opinion. But I think you just have to keep on with the message, and hopefully they'll change their mind.
Well, Dr. Hebert knows we've been in the trenches here in New Orleans, and it gets to a point. It's gotten to a point just personally that Sabra, look, I'm not here to argue with you. I'm only giving you the information. You can either see me today and I can tell you where to get tested. To go get a vaccine, or I can see you tomorrow and tell you where to get tested. We're going to be here either way. We're not going anywhere, and the information is going to be the same. This decision is absolutely yours. But I think that patience thing is the tough part. I'd like for everyone to close out and give us 1 minute closing remarks. We have about 2 minutes left, so I'll cut it to 30 seconds. The party just got cooking. Dr. Andrews and I, we're bidding 4 on the spades hand. We're about to get in. We'll start with Dr. Lenore.
No, I would say that these kinds of panels are really very important, to talk to people, to share our experiences, to kind of understand the frustration that we do feel, but to understand the culture that we're dealing with, and the fact that this is not going to go over, and as I began my remarks right away, and that we're going to have to continue a dialogue with our patients and people in our communities for a very long time. And I want to set the standard by staying in under 1 minute.
Thank you. And you did it. Dr. Naidu.
Yeah, I just want to say, get vaccinated, get vaccinated, get vaccinated. And for those working in the communities, those in the trenches, be patient, talk with people. People sometimes have real fears. And so be patient, hear their fears, communicate.
Dr. Andrews?
Yeah, I would like to chime in and just say in closing that, don't get COVID fatigue. It's the one thing that you mentioned earlier about the angst of the relaxing of the mandates. Don't get COVID fatigue. We're in this, unfortunately, now for the long haul. We need to see it all the way through. Don't give up. For those who haven't gotten vaccinated, I implore you to please get vaccinated. We're beyond having adversarial conversations, trying to disseminate this information. But as you said, we're here for you. We're answering your questions and encourage you to all get vaccinated if you're eligible.
Thank you. Dr. Hebert.
I have a couple of things that we have to say. We have had increase of colon cancer, prostate cancer, breast cancer, all these things because people haven't gone to their doctor's appointments because they're scared of getting COVID. So you've got to maintain the rest of your health. Eat well. Go to get your colonoscopies and your mammograms. Please do that. The second thing that's very important, folks, we're not going anywhere, but the reality is These diseases that we have eradicated are back. The CDC came up and said that measles is on the rampage again. Measles is 18 times more contagious, basically, than COVID-19. And I saw a case, Dr. Lenore and the panel, I saw a case of epiglottitis the other day.
Wow.
H flu epiglottitis, because the woman had a 9-month-old kid and she didn't get him vaccinated because she was scared to take him to the doctor's office, which means he could have died, and we almost had to trach him because you had to get. Remember, we used to have that all the time. Haven't seen it in 20 years. ER didn't know what it was, but all those things will come back if we do not get all the vaccinations, not just the COVID-19.
Wow, Dr. Mack.
Yeah, I think Dr. Andrews and Dr. Hebert just addressed the history, why it's so important. It's proof that we need to get this vaccination for those of you who are not vaccinated. Dr. Hebert just addressed the consequences of what's happening now because people didn't get vaccinated. So it would behoove everyone to get vaccinated. And let me just say, as far as the community and getting people into vaccination, into care, it's a multi-pronged approach. And we got to try different methodologies to make sure that we get the community into care. Thank you.
Thank you, Dr. Mack. And on behalf of the 100 Black Men, first of all, to our panelists, my esteemed colleagues. Wow, you make me feel a little bit smarter just by being on the screen with you. Thank you all for sharing your expertise. We look forward to future panels and the future work that ahead. It's not over, but we got this, right, Dr. Hebert? We got this, right?
Got this, bro.
I'd like to invite everyone to join us for day 2 on tomorrow, Friday, December 10th, which happens to be my birthday. We're going to start tomorrow at 4 p.m. Eastern. There will be economic empowerment, education workshops, mentoring, collegiate 100 workshops you can all find on the website. And I'd like for everyone to take time to enjoy your holidays safely. Remember, get vaccinated, get your booster shot. Stay aware of the things going on around you. Social distance, mask up, wash up, separate, and vaccinate. This broadcast will air again on our national website, Facebook, and YouTube. Y'all have a happy holidays, and thank you.